Dr. Asmita Vashisht, Senior Resident at NDDTC, extend a very warm and heartful welcome to all our esteemed guests, respected faculty and my dear colleagues who have gathered here today to celebrate the 22nd Annual Day of National Drug Dependence Treatment Center. Having completed 22 years, NDDTC continues to be a pioneering institution in addiction treatment, making significant contributions to addressing substance use disorders across India. To begin with today's celebrations, we acknowledge the important role of Ministry of Social Justice and Empowerment, Shri Amit Yadav Sir, Secretary, Ministry of Social Justice and Empowerment, Government of India, as our chief guest today. Welcome, sir. I request Dr. Dipali Negi to present a memento and felicitate sir. I now welcome today's guest of honor, Srimati Carolyn K. Deshmukh, Additional Secretary, Ministry of Social Justice and Empowerment, as our guest of honor today. Welcome, ma'am. I request Dr. Merlin to felicitate ma'am with the token of appreciation. We were also expected to be joined by Professor K.K. Verma Sir, Dean Academics, AIIMS New Delhi, who has not been able to join us at the moment as he is caught up in some work, but Sir might join us soon. Moving on, I also welcome on dais Professor Anju Dhawan ma'am, Chief NDDTC, and Professor Sonali Jhanji ma'am, who have joined our esteemed guests on the dais. To commence today's program, I would now invite on stage Professor Sonali Jhanji ma'am to deliver the welcome address for this special event.
Good afternoon and thank you, Asmita. Shri Amit Yadav Ji, Secretary, Ministry of Social Justice and Empowerment. Srimati Carolyn Deshmukh, Additional Secretary, Ministry of Social Justice and Empowerment. Professor Anju Dhawan, Chief NDDTC. Distinguished guests, faculty, residents, staff of NDDTC. It is my proud privilege to welcome you all at the 22nd Annual Day celebrations of NDDTC. So just to give a snapshot of how we've come far in these 22 years. In the last 22 years, our center has rapidly expanded clinical services. Besides our own establishment in Ghaziabad, we have now 3 community clinics in Delhi, basically to take treatment near the doorsteps of patients in areas of high prevalence of drug use, introduce mobile treatment services for drug abuse, develop new models of care and training, surveyed the magnitude of substance use disorders in the country, have done clinically meaningful research with national and international collaborators, and introduced the super specialty of DM in addiction psychiatry. NDDTC also runs specialty clinic on its premises in Ghaziabad for different special populations. One is for adolescents, one is for the dual diagnosis clinic for patients who may have both mental health and substance use problems, tobacco cessation clinic, family intervention clinic, and women clinic. In AIIMS campus, that is this campus, NDDTC runs a behavioral addiction clinic, dual diagnosis clinic, a TCC, that is a tobacco cessation clinic that was recently initiated in the pulmonary medicine department, and the consultation liaison psychiatry clinic for patients referred from other departments of AIIMS who have both physical and comorbidity and substance use problems. Now, besides being a nodal center of drug abuse, NDDTC is also a WHO collaborating center for substance use. And most recently, the Indian Council of Medical Research has approved the proposal to set up the Center for Advanced Research on Addictive Behaviors, which will focus on addressing excessive and problematic technology use. We continue to expand the reach of substance use treatment facilities nationally through drug treatment centers and also expanding addiction treatment facility centers supported by the Ministry of Social Justice and Empowerment. At present, we have 73 functional ATF in the country. Now today, on our 22nd annual day, we reach another milestone as we inaugurate the first women addiction treatment facility in India and in South Asia. Recognizing the fact that women face unique structural, social and cultural barriers to seeking treatment for substance use and are thus are grossly underrepresented in substance use treatment programs, NDDTC opens its first women clinic in Pardabagh, Delhi for dedicated services for women substance users. We thank all of you who have taken out your precious time to join us in this important milestone in NDDTC journey and have joined us in our annual day celebrations. We do hope you will enjoy the scientific deliberations. So welcome all of you to our program. Thank you so much.
Thank you, ma'am. To commence further our celebrations, we begin with the ceremonial lighting of the lamp, symbolizing wisdom, knowledge and enlightenment. The lighting of the lamp signifies our collective commitment to illuminating pathways of hope and healing. I now invite all dignitaries present to kindly come forward and participate in the ceremony.
Good afternoon to all of you. Shri Amit Yadav, sir, Secretary, Ministry of Social Justice and Empowerment. Madam Caroline Deshmukh, Additional Secretary, Ministry of Social Justice and Empowerment. Professor Sonali Jhanji, my colleagues from the department, from the National Drug Dependence Treatment Center, from the Department of Psychiatry, from Anatomy NNC colleagues from other departments of AIMS as well, residents, staff, NGO partners who have come, thank you all for joining. Professor Raka Jain, retired faculty from NDDTC, Dr. Sandhya Gupta, retired from the College of Nursing. Thank you all for joining. I will be presenting the annual report. It's my proud privilege to do so. And in this report of NDDTC, I'll be talking a little bit about the background of what we do at NDDTC and then highlighting the work done in the last 1 year as I go along. NDDTC was established in 1988 as a de-addiction center, and 2003 it was upgraded to the National Drug Dependence Treatment Center, and it's supported by the Drug De-Addiction Program of the Ministry of Health and Family Welfare. These are our previous chiefs, Professor D. Mohan, who started the De-Addiction Center and conceptualized the starting of a center such as NDDTC. Professor Rajat Ray, who envisioned the services and the scope of our work as it stands today and has recently been awarded the Lifetime Achievement Award in the convocation by the President at in the AIMS convocation, and acknowledging the contributions of all the previous chiefs. The center is a national resource center for the Ministry of Health and Family Welfare as well as Ministry of Social Justice and Empowerment, and it's a WHO collaborating center on substance use as well as a regional learning center of the UNODC. Our objectives include providing higher standard of clinical care and also developing models of treatment. Our focus is a lot on public health and increasing access to treatment across the country, capacity building through training programs, coordinating and conducting research, and providing technical inputs on policies and programs. NDDTC has a multidisciplinary staff. We have 19 faculty positions, including psychiatrists, psychologists. Our staff includes social workers, medicine background SR. Most of our services are provided on outpatient basis and admissions are done as and when indicated. We provide treatment for the whole gamut of addictive disorders, including behavioral addiction, and the treatment includes pharmacological, psychological, and social interventions. Many of our specialty clinics are the first of their kind in the country. such as the women's clinic, the adolescent clinic. We have a clinic for consultation, liaison, addiction psychiatry for those who have medical disorders, and so on and so forth. The community clinics are models of provision of care in low resource settings and have been further replicated to expand services in the country. The psychosocial interventions we provide include from brief interventions to more intensive interventions, and we have a state-of-the-art laboratory that is also equipped to test for newer psychoactive substances. These are some of the services. We run daily OPD. We have a 50-bedded ward that we are going to soon expand to a 100-bedded facility, including a ward for women, adolescents, and a private ward. Besides the clinics already mentioned, tobacco cessation, behavioral addiction are some of the, and family empowerment, dual diagnosis are the other clinics that we run. The new initiatives this year include a tobacco cessation clinic which has been started in collaboration with Department of Pulmonology, and the addiction treatment facility clinic for women which we are going to which will be inaugurated today. In 2024-25, in the current year, we have had more than 1,300 admissions. We have seen 6,647 new patients, and we have had close to 3.5 lakhs follow-up visits made by patients. The community clinics located in Trilokpuri is the first community clinic that we started, demonstrating a low-cost model of treatment. The other two clinics are also located in underprivileged areas in lucid buildings, and the Sundarnagari clinic was the first to conduct a multi-center methadone study and has a mobile methadone dispensing. The Kotla clinic in Kotla Mubarakpur is linked with an NGO and also has night shelter facilities. So each of these clinics has some unique features. These are the laboratory tests that we have done in 2024-25, and besides biochemical, hematological, HIV screening, more than 83,000 drug tests have been conducted. The drugs are listed, and these include not only drugs of abuse but also looking for medications in the biological samples, the urine samples. And we also have facilities for confirmation. The lab is now equipped to detect NPS and also several of the metabolites. Now, what is our further plan? Like I mentioned earlier, we have a 50-bedded facility that's the construction is going to start in this year. It's already been awarded to CPWD. We are also in the process of strengthening clinical services for managing viral hepatitis. Training of doctors has already been done, and this is in collaboration with the National Viral Hepatitis Control Program. We are starting a patient education facility, a yoga and meditation wellness service, and planning a digital system for patient flow management and clinical care. Now coming to the service provision in the country, NDDTC was funded with the support from the Ministry of Health and Family Welfare, started the drug treatment clinics, and subsequently in 2015, and subsequently the addiction treatment facilities with support from Ministry of Social Justice and Empowerment. The DTCs were outpatient based and the ATFs are both outpatient and inpatient based. You can see that combined more than almost 100 hospitals across the country have been reached, and a large number of patients have registered in these services, which are now in lakhs. The total approved addiction treatment facilities are 141, so another 68 are in pipeline, which are going to start very soon. And these services provide treatments for across various drugs and both short and long-term psychosocial and pharmacological. This figure shows the numbers in terms of new patients. In the blue bar, the cumulative registrations, follow-up visits, etc. in the last 1 year in the DTC scheme, and similar showing in the ATF in the last 1 year. Now the further plan is that we have submitted a proposal to the Drug Addiction Program, Ministry of Health, for increase in the number of DTCs and also for addition of inpatient facility. The plan is also to increase the number of ATFs, and we have received a proposal from Punjab, and we have the support of the Secretary Sir here and Madam, Additional Secretary, to increase the ATFs in Punjab. We have also submitted a proposal for starting tobacco quitline services at NDDTC. Coming to our training and capacity building efforts, NDDTC runs the largest DM or super specialty program, which has been there from 2016 onwards. We have 15 seats overall, 5 seats per year. Most institutions provide very brief exposure to addiction during MD psychiatry, and these super specialists become the national resource not only for providing treatment but also for capacity building and providing inputs for policies to their state governments. So there are very few institutions in the country which run this program, and this is ours is the largest one. We also have PhD candidates, MSc Psychiatry, nursing students are also posted with us. We train different cadres of staff across training programs, doctors, nurses, counselors. We have trainings both generic and on specific topics which are listed here. And we conduct trainings for ATF, DTC, for state governments on request, and also for international organizations. We have a telemedicine facility with NDDTC resources on substance use disorder and behavioral addiction, and a self-paced learning management system that was developed with support from Ministry of Social Justice, through which many doctors working in NGOs have been trained. In the current year, we have conducted a large number of trainings. These are the number of states from where the trainees have come, and you can see it's across the entire length and breadth of the country, and it includes doctors, nurses, counselors, other staffs, and almost 1400 persons have been trained. This is a training of trainers program for CHOs that was carried out in Uttarakhand along with AIMS Rishikesh. We have also conducted trainings on request of UNODC, Colombo Plan Drug Advisory Program, Asian Harm Reduction Network in the current year in countries which are listed: Kazakhstan, Nigeria, Sri Lanka and Malaysia. Now, looking ahead, we plan to continue these training efforts for health professionals and paraprofessionals for DTC ATFs. We also plan to expand our telemedicine facilities for trainings of doctors, nurses, both offline and online through Project Echo platform. We also plan dissemination of the online self-paced platform and integration with the platform for Ministry of Social Justice for training of doctors in the NGO sector, and we continue to plan trainings on request from various state governments. As I speak, 2 of our colleagues are in Punjab attending a program there for setting up a resource center there in Punjab. Try to sum up some of the themes that are currently being studied through these research projects: dual disorders, physical comorbidities, looking at special populations, children, youth, pregnant women, behavioral addictions, etc. Now, looking ahead at the research, the MOU for the next national survey has already been signed between the Ministry of Social Justice and Empowerment and AIMS. And this large survey, which the sample size is planned is 1.75 million, will provide district level estimates and will also have focused thematic studies. A Center for Advanced Research on Addictive Behaviors has been funded by ICMR with a large grant with the plan to develop evidence-based interventions for problematic use of technology. We have a brain-computer interface lab for treatment and research, and these are the equipments in the lab. And there is a study which is in pipeline on assessing newer pharmacological options such as long-acting buprenorphine. There are several other projects which are being planned by faculty and have been submitted to various funding agencies. In the last year itself, and every year, we have close to 100 publications, including journals in abstracts, chapters in books, as well as books being published from the center. Coming to policies and programs, the faculty is represented in various national and international bodies. The Addiction Psychiatry Society of India, many of the founding members are from NDDTC. Currently, 2 of the board members of International Society of Addiction Medicine are also from NDDTC, and many of the faculty hold very important positions where they can contribute to national and international these professional bodies and various other national agencies which we are asked to contribute from time to time. The faculty also contributes to international agencies, and recently we have a nomination of 2 faculty going to the CND as well, and many expert committees of WHO etc. have our faculty as members. We had a 12th January, we spent the whole Sunday, the entire faculty of NDDTC brainstorming the vision for the next, let's say 2 decades. And these are some of the pictures of that program which we really enjoyed thoroughly, and how do we go ahead from here. These are also some other happy, fond memories of this year, including our celebration of our Republic Day and other events. Thank you very much for your patient listening.
Thank you, ma'am, for sharing the remarkable journey of NDDTC over this past year. Following this, it is my privilege to introduce Dr. Priyali Mandal, ma'am, Additional Professor at NDDTC. She is one of the consultants at the Women's Clinic, faculty in charge of the ATF Women's Clinic at Faridabad, and the organizing secretary for the today's program. I welcome ma'am to share her insights on substance use among Indian women, a journey from recognition to service provision. Welcome, ma'am.
Thank you, Dr. Ashpita. Throughout today's presentation, I will be taking you through a journey where Indian women were being recognized they should have scientific focus, and from having recognition to service provision for substance user women in India. So in India, we all know that substance use among women is known for ages. However, any use beyond medicinal use has always been a matter of taboo and stigma for women. Research recognition for women substance users has came very late in India, when agencies like WHO, Ministry of Social Justice and Empowerment, the then UNDCP, took some interest and started funding the research on women, and we started understanding the problems among women substance users in depth. So these studies were conducted in community and in treatment settings like general hospital and targeted interventions. Some of them have national scope and some of them have regional scope. In 2019, we had the second national survey, in which women were also a part of the household survey. Additionally, we also had a survey on substance use among school and college students, where women were a part. We have NFHs and GATs as well. And so from these studies, what we have come to know is that the women may be less, the prevalence of substance use among women may be very less compared to men. And there is regional variation. Like suppose alcohol is very common in central part, common among tribal women in central part of India. Injecting opioid drug use is very common among northeastern population. However, the concern is there is narrowing gender gap, particularly among young population, as we have seen in the survey for college students. And there are certain unique features, like there is more use of pharmaceutical opioids, there is high prevalence of smokeless tobacco, Women often present to the clinics or the treatment setting when they are in a disheveled condition, and they are often present with multiple comorbidities and physical and psychological complications. What we have also understood from these studies is that there are multiple barriers to seek treatment for these women. Treatment seeking rate all over India from across centers is hardly 1 to 8.9%. These studies also have given us good insight about the HIV related vulnerabilities among women drug users. When we were busy understanding the problem in depth, what was happening in other part of the world, from 1960 to 2000, the western part of the world has seen a paradigm shift in the approach to treat women substance user. Initially, when there was not much gender segregated data, the treatment was generic. Subsequently, they have developed gender sensitive treatment interventions, wherein the importance of trauma was understood and the treatment was planned to be provided within a safe and affirming environment. This gender sensitive intervention definitely comes with the array of benefits like high treatment completion rate, and most importantly, there is no additional cost to it. So how far we have done, what kind of services we have been able to provide for Indian women substance users till now. As we all know that substance use problem is taken care of by the Ministry of Social Justice and Empowerment and also Ministry of Health and Family Welfare in India, the demand reduction part particularly. So after understanding, having a good understanding of the depth of problem, the ministry was kind enough, the government was kind enough to have the National Action Plan for Drug Demand Reduction in 2020, and wherein there is a provision for separate facility for women. And under that provision, there is one IRCA in Himachal Pradesh, it's completely dedicated for women. There are centers in northeastern part of India and also southern part of India, supported by the Ministry of Social Justice and Empowerment. In NDDTC, we have established Women's Specialty Clinic in 2015, and we also provide inpatient services to women, as Anjuman also has pointed out. NDDTC has provided its expertise to WHO in preparing the guideline for identification and management of substance use among pregnant women. However, there is no facility till date for, especially for pregnant women or lactating mother. There is no legal provision as well for these special population. So at Women Clinic, we see women of all ages and including adolescent and geriatric population. We address all kinds of substance use. We have kept this treatment provision for women a little flexible. And also the treatment, we have kept the treatment entry easy. Since we know it's a matter of great stigma, it's very difficult for them to overcome all the barriers and come to a treatment setting. By flexibility, we mean that we try to engage the family members, and often we encourage their involvement, and also we encourage proxy dispensing and other small facilities which can help them to stick in treatment. This is also a kind of licensing point for other care, like we often send patients to obstetric care or pediatric care as needed, and there is a on-site medicine consultation facility at the center. In synchrony with AIMS mandate, we are also generating evidence. We are publishing papers, and we are also training our DM residents. They are on a rotatory posting to this unit, this women clinic for training. For providing safe space and physical space, we are doing small things like maybe necessary separate queue for women and separate physical space as well. We are doing a study, we have recently completed a study where we have taken inputs from the patients, where they themselves have come up with suggestions how to improve the services and how to provide better care without much stigma. Currently, the Women Clinic have registered about 300 patients so far. We mostly have seen opioid dependent patients, and with high prevalence of psychiatric and medical comorbidity. There is high prevalence of injecting drug user also in the cases we see. We have been managing cases of pregnancy and opioid dependence as well. We have trained about 25 DM residents, Of course, we have challenges. There are the major challenges of attrition and convincing the family for the need for long-term treatment, and also licensing the medical need. We have published papers, and there are ongoing theses as well. These are some screenshots of some of the papers already being published. Some are in pipeline. We are coming up with a dedicated 20-bedded inpatient facility for women at NDDTC, as Anju ma'am has already pointed out. And we are happy to have to develop this new treatment model in India. It's a community clinic for women and by the women. All our women staff here at an underprivileged community under the ATF scheme of Ministry of Social Justice and Government of India. We have named the clinic as Ashwin, which stands for Addiction Support Help for Women in Need.
Deshmukh ma'am, Additional Secretary, Ministry of Social Justice and Empowerment, Government of India, to address the audience. Ma'am, we are eager to hear your perspectives on this important subject.
Respected Secretary Sir, Shri Amit Yadav, Professor Sonali Janji, Professor Anju Dhawan, Dr. Piyali Mandal, Dr. Atul Ambekar, and the faculty, staff and guests of this event. I think it is a very, very happy event, the 22nd NDDTC Annual Day, and which marks 22 years, not counting the years as a clinic, as a de-addiction center, from the day that NDDTC was founded. I think here in this room we have, I think, the collection of the largest number of experts, I would say, in the government sector, in this field of de-addiction, substance abuse, academic-wise and practicing-wise also. During our visit, sir, to this CND, the UNODC, we have had a lot of discussions with Dr. Anju Dhawan. She was also a participant in that, and of course Dr. Atul Ambekar. And what I learned from those conversations is that almost all of the people here, the faculty here, they've dedicated all their lives to studying, to research, and also carrying out these activities and serving the people who need the most in this sectors, addiction and of course substance use and abuse and treatment of. As the last survey, according to the last survey, almost 1.6% of substance users, alcohol, they are women. So that translates to around more than a crore of women use alcohol frequently. And more than 14% of people are substance use people use alcohol and falling into that realm of addiction. So that's a huge number, I think, and that has been almost 7 years since the last survey. And I'm sure now with you embarking on the new survey, we will turn up numbers on maybe even new substances. I think in the earlier survey it was mainly alcohol or opioids, and those were the major substances and cannabis. But now I think, of course, that is outside of our realm, but even like you said, behavioral addiction, nowadays with digital devices, the addiction, I think the space and the area of addiction is even worse. And I think your center is not only a center for substance use addiction, it's also an academic center. You run a PhD as well as a diploma program for behavioral addiction also. So my best wishes to you. And in the context of NAPDDR, in the context of prevention of abuse of substances, NDDTC aims has been the biggest source, I think, of technical support for the Ministry of Social Justice. Though we do have a center in NISD, however, the medicinal part, the treatment part, that comes from NDDTC aims. And I have seen, I've interacted with some of you doctors who had been instrumental in curating and in creating the content for the online self-paced learning. And however, I feel that there is a need for more outreach, for more IEC, for easy access of these self-paced learning to all people who are stakeholders, especially the doctors and also the paramedical people working with the NGOs and other treatment facilities, private as well as government, all across the country. So we need to have a strategy, I think, that how do we make it available and how do we make sure that people are aware, people who are interested are aware. And I believe we had discussed, when I had visited NDDTC aims the first time, we had discussed that maybe we make it more attractive and make it more sought for by giving a certificate or introducing a certificate as part of those courses. I hope that NDDTC along with NISD can work on these lines. In addition, I'm very happy to see that you have put it on your way forward and action plan to put the capacity building of NGOs, doctors and paramedical staff as one of your activities in the action plan. We need to work some more on that. We had discussed this with Dr. Anju during our trip to the CND, and I'm very happy to see it that it's part of a concrete plan. And however, how do we do it? How do we ensure that all the NGOs, all the people involved in these treatment centers run by NGOs as well as the government sector have access to it with limited resources, limited financial resources, and I think that would be a challenge. How do we go about it? But I'm sure if we put our heads together, we'll be able to work out a plan. Thirdly, I think standards. We have NGOs coming and working across all sectors of different standards. State governments also, I think, are funding. But the need to develop standards, the treatment protocols, I believe, are already there. AIMS, NDDTC has worked out some new protocols also. That needs to be shared, that needs to be disseminated across these stakeholders. And I think these are the three areas that we can work together with the ministry. Plus, of course, the content for treatment and for the SOPs for the NGOs. I wish this new center and the doctors, the faculty, the staff involved all the best. And under Sir's guidance, NAPDDR, and a lot of priority, a lot of importance, and we hope to go from strength to strength working together. Thank you.
Thank you, ma'am, for your valuable insights and supports. now welcome Professor M. Srinivasan Sir, Director, AIMS New Delhi, who have joined us today as one of our esteemed guests. Welcome, sir. I request Dr. Shreya to kindly felicitate Sir with a token of appreciation.
So just to break the one thing, in forensic medicine they used to keep the spotters, and one of the spotters used to be one of the substances. So the fellows in the examination, before they look into substance, they put hand into this, put it in the pocket, and then start writing. After some time, there is no substance in that. So some people used to say there is nothing inside. So they used to call the fellows. When the fellow says nothing inside and the fellow is written, the fellow is the last fellow who emptied the jar.
I would also request Sir to kindly address our audience in the context of today's special occasion, the 22nd annual day of NDDTC and the inauguration of the Women's Clinic. Thank you, sir.
Respected Secretary Sir, the senior officers from the Ministry, our own faculty members, and the various people who are the experts in the field of taking care of this, I say it's a menace for the country. So basically, sir, I just want to say that we are committed. We are committed as an institution, as an organization, as a department, as a center, that we are here to take care of any of the assignments and the work which you assign to us, not only for this institution in this state, but for the entire country. This is something which I want to reiterate that, and then it's a time that we give a big hand to the people because it's an annual day and they have a wonderful job, and this is something which is a commendable job which they have done. We will definitely be part and parcel of whatever the projects you take up, the initiatives you take up, whatever the technical groups which you make up, so that we are there for every time with the ministry, not only from the social justice ministry but also the health ministry, whatever the activities which they want to take it up, because it's an integration of both the ministries, because we have a health issue here but a social issue also, and then entirely both put together we will be in a better position to eradicate this problem, because this has become a big challenge for us. It is not just today we are talking about the women's clinic, but it has been a problem for everybody, starting from the children, adolescents, the adults, and the various groups who are the prime of their age, the prime of the age where they can do a significant work and contribute to the nation building, and we are drifted because of the availability and all those things. So definitely, sir, the center will go a long way, and we are here to take up any of those things whichever you give us. And again, I congratulate the entire center and every member of that, from the chief to all the staff members, that they have done a commendable
job. Disorders in India, and the treatment services, as highlighted in the survey report also, were very few, and there was wide treatment gap. So among the certain specific recommendations which were published in the report, one was to find some newer ways through which this treatment gap can be addressed. In response, Ministry of Social Justice and Empowerment, which happens to be the nodal ministry for drug demand reduction in the country, came up with the National Action Plan for Drug Demand Reduction, and subsequently a portion of it in the form of Nasha Mukta Bharat Abhiyan. Till that point in time, and since the publication of this particular National Action Plan, Ministry has started and supported a wide variety of treatment services to address this treatment demand. Most of these treatment services, the facilities, be it IRCAs or peer-led intervention program or outreach and drop-in centers, Most of these happen to be located in the civil society sector, the NGOs. It's with the 2020 NDDTC that Ministry agreed to also start supporting the government hospitals, whereby always the plea was that for those government hospitals, they have the willingness, they have the infrastructure, but they lack some of the resources to be able to efficiently provide these services. So Ministry agreed that okay, we will provide some resources, we will pitch in, and so that both these the participating hospital as well as the union government, both of them can come together and increase the availability of treatment services in the country. For which Ministry entrusted this task to us, AIIMS. Now, in an ideal world, it can be argued that this is beyond the terms of reference of All India Institute of Medical Sciences. Receiving funds from the ministry and disbursing the funds to other hospitals. Our primary mandate happens to be training, capacity building, and not really dealing with the administrative matters. But when the ministry asked us to take up this mantle, take up this role, also we came forward and then worked with the ministry officials to work together on a proposal which essentially implements this addiction treatment facility model in a collaborative manner. So in this model, the Ministry of Social Justice through NDDTC, it provides resources for essential staff, which means contractual doctor, nurses, availability of medicines. So these two recurring sources of expenditure are the biggest short supply in most state government hospitals. They do have infrastructure, they do have some senior consultants which can act as nodal officer or administrators. So that's the model through which the scheme has been running. There are some contribution comes from the participating hospitals and some contribution for recurring grants comes from the Ministry of Social Justice through NDDTC. So in all these areas, the infrastructure is responsibility of the hospital. There is no provision of any new construction, etc. They provide a nodal officer, a consultant psychiatrist, usually a senior faculty member. Then there are funds available for salaries of the contractual staff, which are largely non-specialist. So the demonstration here is that it need not be a very high resource intensive kind of model. And of course, NDDTC looks after the training, capacity building and ensuring the supply chain of medicines, which we now understand is the mainstay of treatment of substance use disorders on a long-term basis. And all these services happen to be free of cost for the patients. For last about 4 years or so, the scheme is on a continuous path of scale-up. As of now, about 142 such hospitals have been approved for opening addiction treatment facilities. 73 of them are already functional. Professor Anju Dhawan has already shown us how about 72,000 patients have been registered since the inception of the scheme so far. And this number is of course going to rise in coming days and coming years. So when the matter came to whether an ATF should also be operated by NDDTC, because we are supporting other hospitals, there should be a facility which we also operate within the same parameters so that we can demonstrate how it is done. That was the idea here. So for other kind of services which are ongoing at NDDTC, either in AIIMS campus or at our Ghaziabad campus, we already have adequate support from Ministry of Health and Family Welfare for recurring expenditure. So doing something routine with the availability of resources under this scheme from Ministry of Social Justice and Empowerment somehow didn't appear very fair. Also, we wanted to establish something new, something different, which is beyond routine, which is more innovative in nature, and possibly as a model which can be learned from, which can be replicated elsewhere in the country. As has been the case with some of the other community clinics which we have opened. Like Professor Anju Dhawan was referring to other community clinics being operated by NDDTC in different parts of Delhi. That model has been picked up by for example, Government of Punjab, and currently they provide those kind of community services in very large numbers in that state. So we wanted to establish a model of this kind, and that's how this idea came up, a women-specific clinic located in a community setting, which also follows the norms established under this scheme. So the infrastructure is not owned by AIIMS. Infrastructure is owned by the local stakeholders, DUSIB in this case, and an NGO which runs an urban shelter as well as another kind of de-addiction center for adolescent population there in the inpatient facility. So the infrastructure comes from somewhere. Ministry through NDDTC will provide support for the contractual staff. For this particular clinic, all of them will happen to be women, and that's how the idea of Ashwin, addiction support help for women in need, that came from. Dr. Piali Mandal will be the in charge of this clinic. For this particular initiative, we sincerely thank the Ministry of Social Justice and Empowerment, Administration of AIMS, and the local administrators including DUSIP, NGO, and the local community there. So thank you very much, and now Dr. Piali will sort of guide us through the process of inauguration of this facility.
Thank you, sir, for setting the stage for the awaited moment, our moment of pride, the virtual inauguration of the ATF clinic for women at Pardabagh. This milestone signifies a major step towards inclusivity in addiction treatment services for women. For this event, I request the dignitaries on the dais to kindly come towards the stage as we virtually inaugurate this ATF center. Sir, ma'am, please come to the stage.
Anything is just fine. Is down or yes. And the support is given to us.
You can see this is located in Pardabagh, just opposite Lal Killa, and this is a underprivileged urban area. This clinic is situated in the third floor of this DUSIP building. In the second floor, the NGO runs its inpatient facility for adolescent substance user.
You have rented out the place or you got it constructed?
So the place already exists and it's a community facility by DUSIP.
Okay, it's a DUSIP.
It's a DUSIP facility, so there is some sort of agreement with them to operate this facility.
The previous clinic at Sundarmati was also in a DUSIP. So it was running an NGO needed syringe exchange program and we took it on the rent from
Sales collections everywhere.
So here is the clinic staff.
We are also honored to hear from one of our patients currently undergoing treatment who will share their personal story titled A Woman's Journey Through Addiction. हमारे साथ आज श्रीमती कोमल चौहान हैं जो हमारे ही ट्रीटमेंट सर्विसेज के अंडर हैं। कोमल जी, हम आपका स्वागत करते हैं कि आप अपनी जर्नी जो आपकी नशे के इलाज के लिए रही है उसके कुछ पहलू हमारे साथ आज साझा करें।
नमस्कार नमस्कार। मैं जब नशे में आई थी नशे की लत लगी थी मेरे को, बहुत ज़्यादा डरती थी घर वालों से बोलने में, इंजेक्शन वगैरह ड्रग्स वगैरह करने में बहुत ज़्यादा डर लगता था। इलाज के बारे में पता नहीं था कहाँ बोलूँ किसको बोलूँ। तो मैंने शादी की, मेरा हस्बैंड भी था, वो भी नशा ही करता था, उसका इलाज चल रहा था कोटला से, तो उसके साथ गई थी, वहाँ से ही।
धन्यवाद कंचन जी। आपने हमारे साथ थोड़ा सा अपने बारे में शेयर किया, उसके लिए धन्यवाद। ऐसी जानकारी मिलने से हमें भी प्रोत्साहन मिलता है आगे अपना काम करने में। सो थैंक यू फॉर शेयरिंग योर इंस्पायरिंग जर्नी। As we approach the conclusion of this event, I would like to invite on stage Dr. Shalini Singh ma'am to deliver the vote of thanks, expressing our gratitude to all the audience.
Honorable Chief Guest Sir, our guest of honor ma'am, and our special guest, Director Sir, the organizing chairperson of this conference, Professor Anju Dhawan, faculty members, residents, and all of our invited guests, I express my heartfelt gratitude to all of you on this special day for us at NDTC, and thank you for honoring this invitation with your presence. I express my profound gratitude to our chief guest, Shri Amit Yadav ji, who despite his numerous commitments and rather tight schedule, has found time to grace this occasion personally. Thank you, sir, and your message to us was very inspiring. I profusely thank our guest of honor, Caroline Deshmukh madam, for gracing this event. I believe, ma'am, that we will all profit, we continue to profit from your insights and outstanding experience in this field. Thank you. We are so grateful that our director, Sir, Professor Srinivas, is here with us today. Sir, your words are very motivating for all of us. I also would like to thank our representatives from various NGOs, especially Mr. Bilal from SQIM. I also would like to thank all the faculty who have joined us from other departments. On behalf of the organizing committee, I thank Professor Anju Dhawan, our beloved chief, for her unwavering support and guidance during the past weeks. Thank you, ma'am. A special thank you to Professor Atul Ambekar and Dr. Piyali Mandal for bringing us up to speed with the giant strides that they're making in the field of addiction psychiatry. कंचन जी, आपका बहुत बहुत शुक्रिया कि आपने हमारे साथ अपनी लाइफ की जर्नी को शेयर किया. And I thank Dr. Asmita for gracing the dice with her wonderful calming presence, and Dr. Merlin Matthew for all the efforts behind the scene. And I thank all the NDTC faculty members, all the residents who came all the way, the administrative office staff at AIMS, the NDTC transport team, the boardroom staff, security and housekeeping staff for extending the relentless support wherever required. Thank you so much.